Ovarian cancer, often referred to as the silent killer, is a formidable adversary in the realm of women's health. This type of cancer is notorious for its elusive and vague symptoms, which often lead to late-stage diagnoses. As one of the most deadly gynecological cancers, understanding the signs and risk factors associated with ovarian cancer is essential for early detection and improved survival rates. This article aims to delve into the subtle signs of ovarian cancer, shedding light on the importance of awareness and vigilance in the fight against this formidable disease. Understanding ovarian cancer. Ovarian cancer originates in the ovaries, the female reproductive organs responsible for producing eggs and female hormones. It is a complex disease that encompasses several subtypes, each with its own unique characteristics and behaviors. The challenge with ovarian cancer lies in its asymptomatic nature during its early stages, which often results in late-stage diagnoses when treatment options are limited and the prognosis is less favorable. Who gets ovarian cancer? Ovarian cancer affects women and people assigned female at birth AFAB. It's slightly more common in Native American and white populations than in people who are Black, Hispanic, or Asian. In addition, people of Ashkenazi Jewish descent are much more likely to have a BRCA gene mutation, placing them at a higher risk for breast and ovarian cancer. Ovarian cancer accounts for 1% of all new cancer cases in the U.S. The lifetime risk of developing ovarian cancer is approximately 1 in 78. What causes ovarian cancer? The exact cause of ovarian cancer isn't yet known, but some people have a slightly higher risk of developing the condition. Ovarian cancer risk factors include being over the age of 60, obesity, a family history of ovarian cancer. Others in your biological family have had the disease or have inherited a gene mutation or Lynch syndrome. Never being pregnant or having children later in life. Endometriosis. There's also an increased risk of developing ovarian cancer as you grow older. How does ovarian cancer spread? If ovarian cancer spreads, it usually does so from your pelvis to your lymph nodes, abdomen, intestines, stomach, chest, or liver. How is ovarian cancer diagnosed? Despite years of research, experts haven't yet developed a successful ovarian cancer screening test. For this reason, the condition is often difficult to diagnose in the early stages. If your healthcare provider suspects ovarian cancer, they'll ask about your symptoms and perform a pelvic exam. During the exam, they'll check for any abnormal growths or enlarged organs. They may recommend additional tests, including imaging tests. Providers may use several imaging tests, including pelvic ultrasound, MRI magnetic resonance imaging, CT scan computed tomography, PET scan positron emission tomography. Blood tests. Blood tests look for a substance called CA-125. High levels of CA-125 in your blood can be a sign of cancer. However, CA-125 levels can be normal even when cancer is present, and higher in many conditions that aren't cancer. Because of this, providers use blood tests in combination with other tests to diagnose ovarian cancer. Surgical evaluation. Providers can diagnose ovarian cancer during surgery. Typically, if they find abnormal growths, they'll remove them during the same procedure. Laparoscopy. During laparoscopic surgery, a surgeon places a thin camera laparoscope through a small cut, incision, made in your abdomen. Using the scope as a guide, along with additional ports to hold instruments, the surgeon can assess the cancer, perform staging biopsies, and, in some circumstances, remove ovarian tumors. Common symptoms. While ovarian cancer is often symptomless in its early stages, some women do experience certain symptoms that may raise suspicion. It's important to note that these symptoms are not exclusive to ovarian cancer and can occur for various reasons. However, persistent and worsening symptoms should prompt a visit to a healthcare professional for further evaluation. Common symptoms associated with ovarian cancer include abdominal or pelvic pain. Persistent pain in the lower abdomen or pelvic region that is not alleviated with over-the-counter pain medications could be a red flag. Bloating. Chronic bloating, feeling full quickly while eating, or experiencing difficulty eating due to bloating could be indicative of ovarian cancer. Changes in bowel habits. Unexplained changes in bowel habits, such as constipation or diarrhea, that persist for weeks should be investigated. Urinary symptoms. Frequent urination, urgency, or discomfort while urinating can sometimes be linked to ovarian cancer. Appetite loss or feeling full quickly, a sudden and unexplained loss of appetite or feeling full after consuming small amounts of food could be a sign. Fatigue. Ongoing fatigue that doesn't improve with rest might be related to ovarian cancer. Back pain. Unexplained back pain, particularly in the lower back, can sometimes be associated with ovarian cancer. Changes in menstrual cycle. Women who have experienced significant changes in their menstrual cycle, such as heavy bleeding or irregular periods, should consider seeking medical advice. Risk factors and prevention. While the exact causes of ovarian cancer remain unclear, several risk factors have been identified that might contribute to its development. These include age. The risk of ovarian cancer increases with age, with the majority of cases occurring in women over 50. Family history. A family history of ovarian, breast, or colon cancer can elevate one's risk due to genetic mutations such as BRCA1 and BRCA2. Personal history. Women with a history of breast, uterine, or colorectal cancer may have a higher risk. Reproductive history. Women who have never been pregnant, had trouble conceiving, or started menstruating at a young age might be at increased risk. Hormone replacement therapy. Long-term use of estrogen-only hormone replacement therapy may alleviate the risk. Obesity. Being overweight or obese has been linked to a higher likelihood of developing ovarian cancer. Endometriosis. Women with endometriosis, a condition where tissue similar to the lining of the uterus grows outside the uterus, might have a slightly increased risk. Prevention strategies include maintaining a healthy weight, using oral contraceptives, which can reduce the risk, and considering risk-reducing surgeries for women with a strong family history or certain genetic mutations. The importance of early detection. Early detection plays a crucial role in improving ovarian cancer survival rates. Unfortunately, due to the absence of distinct early symptoms and effective screening tests, the disease often goes unnoticed until it has reached an advanced stage. However, heightened awareness and vigilance can lead to earlier diagnosis and better outcomes. Women should trust their instincts and consult a healthcare professional if they experience persistent and unexplained symptoms. Seeking medical attention. If a woman experiences symptoms that are persistent, unusual, or worsening over time, it's imperative to seek medical attention promptly. A healthcare provider will likely perform a thorough physical examination, inquire about medical history, and potentially order diagnostic tests such as transvaginal ultrasound, pelvic CT scan, or blood tests like CA125, a tumor marker associated with ovarian cancer. Additionally, a referral to a gynecologic oncologist might be recommended for further evaluation and management. Ovarian cancer's silent nature makes it a formidable adversary, but awareness and vigilance can help turn the tide in favor of early detection and improved outcomes. Women need to familiarize themselves with the subtle signs and risk factors associated with ovarian cancer, and healthcare professionals should maintain a high level of suspicion when presented with potential symptoms. By recognizing the importance of early detection and seeking medical attention promptly, we can collectively contribute to a future where ovarian cancer is detected at its earliest, most treatable stage. We appreciate your likes and subscriptions to our channel for more valuable insights into maintaining wellness throughout life. Wishing you a fulfilling and vibrant journey ahead.